Femi ARATOKUN Ali, security consultant and public affairs analyst, joins us now via Skype from the United Kingdom. Femi, good morning. It's good to have you join us right now. Can you make us understand how bad is the situation in the UK where you are?
Well, good morning and thanks for having me. This is a very serious time for everybody all over the world, and we really don't know what to say. We have no future, as in, are we going to have it ending soon or not? However, the situation is not far-fetched from what you've seen so far on websites, internet, and social media. It is terrible. We are in complete total lockdown in UK. The only thing that is actually moving right now, as seen, are going to be the ambulances, the UK police officers, and some key frontline officers, nurses and doctors, and security officers walking around the streets to make sure that infrastructure, safety of lives and properties are fully protected.
Now, has this raised any form of security concern in the UK?
As I speak to you right now, you can see me, I'm more like fully dressed. In some few minutes time or hours time, I will be on my way to be in position for some other security lockdown, because the security situation is that we're going to be having some common criminals and some ideas of, security opportunists that want to, invade offices and steal things, probably, steal food as well. It boils down to the fact that if you don't have some certain security measure in place, then the security is going to turn back to chaos, and people will just, go back to lawless ideas that they might have in their brains. So it is good for us to have security in place while the total lockdown is enforced.
All right, the UK has about 7,500 active cases as it is right now, with about 422 deaths. What drastic measures is the government putting in place as we speak?
Well, the biggest measure they've taken so far right now is they've turned one of the biggest event centers in London, which is at Southeast London. I mean, sorry, no, not Southeast, but East London, into a makeshift hospital that is going to probably, house or contain any patients or any emergencies we might be having very soon. So Excel Center has been turned into a serious makeshift hospital. We are trying so hard, and the UK government is trying so hard to make sure that we do not record as much death as possible, but it's inevitable if we don't listen to the 2 meters rule, the social distancing, and stay at home as in the lockdown, then the situation will definitely go out of hand. It might just go like a domino stage that we just see death, climbing up and up and up till it will stop. So we have to listen to what the government is saying, what the experts and the doctors are saying, that please stay at home, let's keep hope alive, and let's keep our family together. This is the high time. We need to reset our common brain and button that what have we been doing so bad in terms of infrastructure, health-wise, that we've not been doing. So perhaps this is the high time for us to invest better into our healthcare sector, both in UK and in Nigeria.
All right, the Prime Minister came up with stricter measures yesterday, and I'm wondering, wouldn't it be a challenge for those measures to be breached by hoodlums or any persons who might want to be a security threat to the UK?
Well, at the moment, we are seeing some challenges, happening around, because when the lockdown is now in real enforcement, the enforcement has happened already, so it's not that when it's going to be happening, it's happening, but there will be criminal activities going on. However, it is not left for the security operators and the operatives to now see how best to cope with it. It's going to be a tough one, because no one has ever experienced this before. So we just have to go along with it and start learning from the curve of what we're experiencing from day-by-day situation at the moment in UK.
All right, let's bring it back here to Nigeria, where we are. You have been here so many times and you have crisscrossed this country. You've seen how things are. Now, the government, state government and the federal government are putting up different measures to ensure that they curb or contain the coronavirus. How do you think this is going to impact on security? Although we have not heard so much about Boko Haram or herdsmen or bandits in the last few weeks. But besides that, there are other issues.
Well, the first thing that I can see the government trying to do first is to put a total lockdown on social gatherings, areas and events, which has not really been enforced. However, it's been enforced, but people are not trying to, take proper caution and, follow the rules and instruction, which is a challenge already. And we don't know how long people will listen to all that. Apart from saying that, the movement of people will be restricted, so that will be, there's going to be a breakdown into criminal activities. That's for sure. We're going to be seeing that. But having said that, how well protected are our security officers? That means our police officers and other security agencies in Nigeria. If they are not being given the right PPE to carry out these duties, that means they are going to be open to other kind of challenges that they might not be able to cope with at the moment.
So what would you expect security personnel or the government to put in place to check activities of hoodlums or criminals that might stem up as time goes on?
Well, basically, the police can't do it all alone, so this is where we're going to be needing the community policing around that we have at the moment to work in conjunction with the Nigerian police force, so that they can enforce and how do I put it? Let me put it this way: challenge any movement that is not called for at the moment, especially within our highways and within our roads that are being locked down at the moment. All efforts should now be into how do we put a total lockdown so that our hospitals in Nigeria will not be overwhelmed with patients that are dying or that need help at the moment.
All right, Femi ARATOKUN, thank you so much for talking to us from London. All right, Femi ARATOKUN, a security consultant and public affairs analyst, joins us now via Skype from the United Kingdom. Femi, it's good to have you join me right now. Let me start with the issue of enlightenment. There are so many platforms on which the WHO, the countries and even different agencies have been enlightening people. There are the media across the world. But how much of how to protect and how to isolate and what to do the people themselves know about coronavirus?
Well, I think some people are yet to have this information, and it's unfortunate that the information is not reaching out to some remote areas globally. Let me put it globally, not only in Nigeria alone. Even as we speak, some people don't even have a clue what coronavirus is. You see some of our youth members all over, around the world using it just as kids play in the club and all the rest. But as I speak to you, look, I've got my own sanitizer with me 24/7. It stays with me so that wherever I do, I have to just clean up my hands, wash my hands with water and soap at least for 20 seconds or more than if need be. So these are part of the practical measures that we should at least, we within the frontline services bring out to people and let people understand this. Even if people are coming to visit you, make sure that they do please wash up their hands, sanitize before any contact is made.
There is even the advice of people not visiting at this time.
All
visitations should be on hold. Everyone should stay at home for now. We have hand sanitizers here.
As well.
That's how it goes. And hand sanitizers for everyone. And it goes, yes.
To be honest with you, let us be very practical. In Nigeria, as we know, it's not possible during this lockdown for maybe your street friends or colleagues not to come down to your house to visit you. No matter how we say it, it's definitely going to happen. But how well can we measure our safety in terms of cleanliness and how do we keep tidy our environment? You see, it's all down to what we are meant to do that we've left for not doing for so long a time, and now it's playing a part in our life today. Perhaps this might probably reshape the way we live, the way we clean, the way we do things, and put our health check into place. That what do we need to take as priority in terms of the kind of services we put out to the member public. So it's playing a part, and it's going to reset the way we live now.
Speaking about reshaping how we think, the issue of self-isolation has been a challenge, where even when, to the extent that doctors, medical personnel are begging persons to please stay at home, but they are finding it difficult, challenging. I wonder how it has been for you. Let's speak from your experience. I'm certain that you have been at home for some time now. Share with us how it has been.
Well, as we speak right now, it's so terrible that my family members, they are still sleeping, so I can't really talk so much. By the time I finish up with TVC, Nigeria, and International, I will definitely be on my way with my car straight down to go back to frontline services. It is hard for me as a person, and it's going to be hard for some parents as well, especially the nurses, the doctors that will leave their loved ones at home just to protect us. So it is serious. It is a big challenge. And the biggest challenge they might face in Nigeria today is going to be, how do we control the crowd within the market area? Because a lot of people will be panicking to do their buyings, and what we are even buying, we do not have any proper way of storing them. So it's going to be a serious and huge challenge for the security officers, that how do we do this if they don't have the proper information and the proper PPE to wear to control the crowd? So we should expect the unexpected today. We should see fighting. We should be expecting all that. But please and please, let us still look for a way to maintain this law and order. It's not going to be easy, but one way or the other, we have to see ourselves through it.
All right. Femi ARATOKUN, thank you so much for your time.
Femi ARATOKUN, security consultant and public affairs analyst, joins us now via Skype from the United Kingdom. Good morning and thank you for joining us. Now, there has been an advocacy of mass releases from prisons, and recently a lawmaker was also touting this for Nigeria to do, but this has raised concerns among Nigerians. What do you make of this?
Well, basically, for them to think of mass release of prisoners has to be on part, they have to prioritize it, who are most at risk, who are those getting near to their release dates, and who are the most dangerous criminals that we don't even think we need to release. But how do we now apportion all these people to probably different locations or look for safety measures around them is key, and it has to be seriously looked into by the Interior Minister in the country.
All right. Now, a lot of people are saying that the coronavirus now is going to change and alter the way people do a lot of things going forward. If we liken that to issues of hygiene and how to engage socially on the African continent, or especially Nigeria, do you think that is going to work that way?
I want to tell you one thing. It is going to work because it puts a lot of people now in a position of looking for ways to retrain our public servants. And again, it's going to put us in a situation whereby a lot of health and safety has got to be put in place and put as priority, which we've always been neglecting for so long a time in the country. Because right now, as you speak, even if you move around public areas, you can still see that no one is really taking proper care or attention into how do we take care of ourselves, or perhaps, protect ourselves from this kind of virus or diseases going on around. Do not let us forget, we've been advocating for health and safety for so long a time, but I think it's high time for us to now put a whole lot into place and put a whole lot of investment into our health services.
Another concern is those in the IDPs and those living in areas that have been challenged security-wise. I wonder how vulnerable you view them to be to issues of coronavirus, and how much of a security challenge that will be.
The security challenge around the IDP is going to be overstretched now because the extremists, the Boko Haram insurgents, and the criminal activities will now be on the rise, because they will see that all focus, all attention is now towards the pandemic and not on them anymore. So they will use that as an opportunity to lynch as much havoc as possible, kill as much as possible, without even the government noticing or even the media paying attention to that, which is going to be very difficult for the military to contain at the moment, because the military, they've got so much to deal with, And right now, with this virus going on, it is going to put them under double pressure to cope.
Now, talk to us basically about the issue of compliance to restrictions and shutdowns, especially in the UK. How is it playing out? How compliant are the people and other institutions to the lockdowns and especially in the society?
Well, at the moment right now, people are beginning to come to terms that they have to be at home. But having said that, we still need some key volunteers for some key areas that we need help, like our NHS services in UK. They've been overstretched, so the government is calling back on retired doctors, retired nurses, retired health services, and a whole lot of people to come out and come and assist and help voluntarily, because we have about 1.5 million people with underlying health issues that will need help. Some people are at home, they need help already. Now, if they are isolating them completely, who is going to give them the help they need? So we need support from everywhere right now in UK to volunteer and help, which is actually going on right now. So I believe Nigeria should look into how do we help our elderly as well. Our elders are there. How do we help them is another key thing our government should be looking at the moment. But if they don't look into that, it's going to put another strain on our health service, which is currently, being toughened up at the moment.
All right, Femi ARATOKUN, thank you so much for speaking with us.